Imagine your typical morning. You check the news headlines, maybe look at some medical test results online, perhaps help a family member apply for a job or school. Could you do any of that without reliable internet? For most of us, the answer is a pretty quick no.
Right.
But, for a big chunk of Americans, this isn't just hypothetical. It's their daily reality, a
Yep.
real challenge.
And that right there is the core paradox we're looking at today. We live in this world that's increasingly driven by digital connection, advanced healthcare.
Yeah.
But so many communities are just being left behind. And it's not simply about, can someone get online? It's this really complex, interconnected web of factors, things that dictate health, opportunity, often along surprising lines that, well, they defy our usual assumptions.
Absolutely. So our mission today, we're going to take a deep dive into how these critical challenges, things like broadband access, health equity, how they disproportionately hit underserved communities. And that means both rural and urban areas. We're actually going to explore some maybe unexpected ways these seemingly opposite places might find common ground for solutions. We'll be unpacking insights from a recent congressional report and a White House toolkit that focuses on community-based strategies. So get ready for some honestly eye-opening facts. This is a vital conversation that affects all of us. Okay, so let's start by digging into this idea of the digital divide. We all kind of get that internet access is foundational now, right, for modern life. It underpins everything: school, work, healthcare, even just, participating in civic life. And the COVID-19 pandemic that just made it blindingly obvious.
Oh, absolutely. Pushed so much more online.
Exactly.
Yeah.
We saw firsthand how vital connection was when, physical access just wasn't possible.
And a key thing the reports highlight is that the reasons for this lack of access, they're not the same everywhere. In, say, purely rural communities, the main barrier is often pretty straightforward: lack of physical broadband infrastructure.
Right. The wires just aren't there.
Exactly. It simply hasn't been built out. But if we look at the bigger picture, in many urban areas, the issues kind of shift. Infrastructure can still be a problem, sure, but the main hurdles are often the high cost.
Affordability.
And digital literacy,
Yeah.
It's not just about the wires, it's can you afford it and do you have the skills to actually use it effectively?
And here's where it got really interesting for me in the data. It really challenges some common ideas about this divide. The disparities within urban areas are quite stark. Get this: majority Black communities, broadband connection rate of just 59%. Hispanic communities, a bit better, but still lagging at 65.4%. Now compare that to an average of 81.2% in majority white communities.
Wow.
That tells you loud and clear it's definitely not just a rural problem, it's deeply rooted in our cities too.
Yeah, and this really prompts us to rethink how we usually frame that urban-rural divide. The Congressional District Health Dashboard, the CDHD, it uses this more nuanced thing called the District Density Index.
Okay.
So it moves beyond just simple rural or urban boxes. Instead, it categorizes districts along a spectrum, from pure rural all the way to pure urban, with several suburban mixes, in between.
That sounds much more useful, more granular.
It allows for a much more, textured understanding of where people live and how that affects their access.
So what does this density index tell us about connection rates then?
Well, back in 2021, the U.S. average was about 72%. Predictably, maybe, pure rural districts were lowest, down at 62%.
Okay, that fits the narrative.
Right. But here's the surprise. Pure urban districts at 73% were only slightly above that national average. And crucially, they were lower than the 76% rates seen in the surrounding urban-suburban mix and dense suburban districts.
Lower than the suburbs right next door.
Exactly, which strongly suggests, historical disinvestment in those central cities. It's a pattern of neglect that looks strikingly similar, actually, to what we see in very rural areas.
Okay, let's make that concrete. The Illinois example you mentioned.
Yeah, Illinois is a good case study. The state average is almost bang on the national one, 71.8%. And you see some of the lowest rates in those pure rural districts like Illinois 12th and 15th. These are often areas tagged as working class country or rural middle America, typically less diverse, tend to lean Republican.
Right, southern Illinois, parts of central Illinois.
Precisely. But then you look right next door to the really highly connected suburban districts around Chicago.
Like the North Shore, western suburb.
You find these pure urban districts, Illinois 4th and 7th, with much lower connection rates, like 65%, 67.8%. These are diverse, dense areas, big cities, urban suburbs, places that lean strongly Democratic. A huge contrast to their wealthy suburban neighbors.
So wait, you're saying districts that are worlds apart, geographically, politically, demographically, like deep southern Illinois and parts of Chicago's core, they share this same fundamental struggle with getting online.
That's exactly it.
So the connectivity gap isn't really about urban versus rural then, is it? It's about disinvestment, where the money hasn't gone.
That's the crucial insight, yes.
Ah.
Focusing just on urban-rural as polar opposites, it misses this critical nuance. And the source also highlights how this lack of broadband directly hits critical services.
How so?
Well, think about it. Areas with high shortages of mental health professionals, they often also lack broadband, which means telehealth, a really promising solution for expanding care access, becomes tragically inaccessible.
Wow, so the tech solution can't even reach the people who need it most because of this other infrastructure gap.
Precisely. It compounds the problem.
Okay, moving from digital connection to physical well-being, let's talk health equity. And here's a fact from the Ways and Means Committee report that it stops you in your tracks. The U.S. spends almost twice as much on healthcare as other developed countries.
Yeah.
Yet, we consistently have worse outcomes.
Yeah.
What does that profound imbalance even mean for the health of our communities?
Well, it begs the question, right? Why spend so much for, frankly, so little return comparatively? The Left Out report details how these underserved communities, both rural and urban, face this complex mess of health challenges.
Like what specifically?
Things like aging infrastructure, long-term economic disinvestment that just strips communities of resources, and these widespread workforce shortages across different medical fields. The core issue seems to be our system often prioritizes expensive, reactive, acute care.
Instead of prevention.
Exactly. Instead of fundamental preventative measures and really addressing those social determinants of health. So we end up getting less health per dollar spent compared to our peers.
Can we put a human face on those disparities? The report mentioned life expectancy.
Yeah, that was stark. So between 1969 and 2009, folks in urban areas saw much bigger improvements in life expectancy than rural residents did. Okay, maybe not surprising. But here's the really sobering part. By 2009, Black rural residents and low-income rural residents were only just hitting the life expectancy that urban whites had reached. Get this, 40 years earlier, back in the 1970s.
40 years, that's just a staggering gap, an entire generation behind.
It really illustrates that persistent inequity. And what stands out here is that for non-white residents in many of these communities, health status, outcomes, they're often exponentially worse. And this isn't just about individual choices, you know.
It's systemic.
It's about systemic failures. We see these persistent, alarming disparities in prenatal and maternal health. The U.S. ranks, it's dismal, 170th globally for infant mortality, 138th for maternal mortality, despite spending all this money.
And the racial disparities within that are just horrifying. Black and indigenous pregnant women dying at 3 times the rate of white women. And the report also mentioned something about hospitals, that 75% of Black women deliver at a smaller group of hospitals that tend to be lower quality.
Yes, exactly. Lower quality, higher rates of complications. It points to critical health system factors. Workforce shortages are a huge barrier mentioned in the report.
How bad are we talking?
Well, we're projected to have a shortage of over 23,000 primary care physicians by 2025. And mental health. It's even worse. Almost 113 million Americans live in designated mental health professional shortage areas.
113 million.
Yeah. And get this, 96% of counties lack a psychiatrist who can prescribe medication. 60% lack any psychiatrist services at all. The implications are just profound.
And beyond the workforce, the actual buildings, the access points are crumbling too.
Yeah.
Especially rural hospitals.
Absolutely. Rural hospitals are closing at alarming rates. The rural South alone lost over 3,500 hospital beds since 2005. It creates this vicious cycle, right? Low patient volume, low insurance rates makes it hard to attract providers, which leads to what many call obstetric deserts.
No place nearby to safely deliver a baby.
Right. And other care gaps that just tragically perpetuate chronic conditions from one generation to the next.
So it's clearly not just about doctors and hospitals then. The sources make it really clear that factors way outside the clinic walls, what we call social and structural determinants of health, they're fundamentally driving these inequities.
Exactly. To put that in context, we're talking critical elements like transportation access. Can you even get to an appointment? Widespread poverty, the presence of food deserts where fresh food is unavailable, housing instability, the quality of education, social isolation, even the quality of the air you breathe and the water you drink. Like urban residents, they experience 10 times more low air quality days than rural residents. That has direct health consequences.
And underneath many of those issues are these larger structural forces. The congressional report explicitly calls out structural racism and economic inequality
Yeah.
as key drivers.
Yeah.
Policies affecting everything from housing, think historical redlining, to infrastructure development have systematically created conditions where health risks, access to resources, it's all unevenly distributed. These factors feel so foundational. I mean, where do the reports suggest we even begin to tackle such deep problems?
That is the critical question, isn't it? And it's why these comprehensive reports are so vital. They emphasize these issues don't exist in a vacuum. To see how it plays out under pressure, just look at the COVID-19 pandemic. It was a stark, tragic case study, magnified all these pre-existing vulnerabilities.
Yeah, I remember it being called a racial pandemic within a viral pandemic.
Exactly that phrase. For instance, Milwaukee County. Black Americans were nearly half the COVID cases and a staggering 81% of the deaths, despite being only 26% of the population.
81%, that's
Yeah.
devastating.
And in Chicago, 70% of deaths from a 29% Black population. The numbers are just heartbreaking.
And it wasn't just big cities, right? The Navajo Nation had the highest infection rate in the whole country at one point.
That's right. And these disparities, they're tied to things like higher rates of underlying health conditions, comorbidities, increased exposure in those essential jobs that often had less protection, less access to paid sick leave or work from home options for minority workers, and just that historical underinvestment in their communities. It all combined to leave them far more vulnerable.
Okay, so the challenges are enormous, complex, deeply rooted. What can actually be done? It feels overwhelming. But you said the sources point to promising models.
They do. Models that tackle these complex issues by looking at the whole person, the whole community. And this is where the concept of community schools really seems to shine as a holistic approach.
Community schools. Tell me more about that. What are they exactly?
Well, what stands out is how they act as true community hubs. They integrate educational services, developmental support, family resources, health services, other comprehensive supports directly into the school building.
So not just 9 to 3 education.
Not at all. It's before and after school, weekends, even during the summer sometimes. It's a truly holistic approach, and it's built on 4 key pillars that support the entire community.
Okay, so what's at the heart of this model? Walk us through those pillars.
Sure. The first pillar is integrated student supports. This is about addressing those barriers, both in and out of school, that hinder learning and well-being. Things like health and mental health needs.
Okay.
So this might involve, say, school-based health centers offering direct care, or programs like the Pediatric Mental Health Care Access Initiative, PMHCA. Yeah, it uses telehealth, actually, to integrate behavioral health right into primary care settings within the school or linked to it. And it specifically targets those racial, ethnic, geographic disparities in access we talked about. There are even grants available to pay salaries for nurses, physicians, school coordinators in these centers.
So that connects directly back to the broadband issue. Telehealth becomes viable if the connection exists, and the school can be the place to facilitate it.
Precisely. It bridges the gap. Okay, the second pillar is active family and community engagement.
Right, getting parents involved.
Absolutely. Bringing parents, families, community leaders into the school as real partners in education and decision-making. The school becomes a genuine community center for services and activities for everyone.
Okay, 2 pillars down. What's number 3?
Third is expanded and enriched learning time and opportunities. This means offering programs outside of the regular school day. Think STEM workshops, arts programs, real-world learning experiences, internships, things that make learning more engaging and relevant.
Makes sense. And the final pillar, collaborative leadership practices. That sounds like it ties it all together.
It absolutely does. This pillar is about creating shared responsibility for the school's success. You have leadership teams that include students, parents, community members, often facilitated by a dedicated community school coordinator.
The coordinator role. That sounds key.
They are crucial. They empower people, build relationships, oversee the delivery of all these integrated services. And the reports highlight how federal programs from USDA, HHS, HUD, Department of Labor, DOJ, they're all supporting these efforts.
Wow, support from across agencies like what?
Oh, things like school breakfast grants, funding for distance learning tech, programs to address youth violence, even housing assistance linked through the school. It's a truly multi-sector approach trying to happen.
That integration sounds powerful, that vision of support from so many federal agencies. But, I mean, with so many different efforts, do the reports say if these are truly coordinated on the ground, or is there still a risk of, siloed initiatives even with this ideal.
That's a really fair challenge. Look, the ideal is coordination, and the White House toolkit certainly pushes for it, outlining strategies for interagency collaboration. Real-world implementation always presents hurdles, right?
Here.
Bureaucracy happens.
Exactly. But the emphasis on having that community school coordinator role is specifically designed to bridge those gaps at the local level, to make sure the services are actually integrated for the families they serve, rather than just operating in separate bubbles.
Okay, so the coordinator is the linchpin.
In many ways, yes. And we do have some really compelling real-world examples that show the power of this kind of integrated, community-tailored model. Alaska's perinatal regionalization model, for instance.
What'd that do?
Incredible results. It took Alaska from having the highest post-neonatal infant mortality rate in the U.S. down to the lowest.
Wow.
By bringing providers to rural areas and, importantly, housing pregnant women near medical hubs for the actual delivery, ensuring access to critical care right when it was needed.
That's a fantastic transformation. Any other examples? Yeah, back in Chicago, there's the Better Health Through Housing initiative. It's a partnership between the health sector and housing sectors.
Okay.
And for its clients, it showed remarkable results. Reduced hospital costs by 21%, and hospital utilization, people needing to go to the hospital, by 67%.
67% reduction.
Yep. These are really powerful examples of how community-tailored, multidisciplinary solutions, they don't just work, they can lead to significant improvements in both health and economic outcomes.
This deep dive, it's really shown how these challenges, broadband access, health equity, they're profoundly interconnected, aren't they?
Absolutely.
And they hit such a wide range of communities, often in ways that they really defy those simple urban-rural boxes or political lines we draw. Whether it's no internet in a disadvantaged city neighborhood or an obstetric desert in a rural county, the root causes disinvestment, systemic inequity, have these startling commonalities.
Yeah. And the broader implication here is clear. There just aren't any silver bullet policies, no single fix. The complexity demands these community-tailored interventions, recognizing that each area has unique needs, unique histories.
Including facing things like structural racism head-on.
Absolutely. Including understanding and addressing issues like structural racism, economic inequality that has shaped these disparities over generations. You have to deal with the context.
Which is why these holistic approaches like community schools, with their comprehensive, integrated, collaborative pillars, why they feel so vital. It seems like they're about bringing people together, within schools, across different agencies, even between diverse communities, to tackle the root causes of inequity. Instead of just constantly putting bandages on the symptoms, it feels like it's about building resilience and opportunity from the ground up.
Wow. What an illuminating deep dive this has been. We've seen how lacking broadband isn't just, an inconvenience. It's a fundamental barrier to health, to education, to opportunity.
And with these surprising commonalities between disadvantaged urban cores and rural landscapes, we've also explored the profound health disparities that persist, often starkly along racial and geographic lines, and how a holistic, community-focused approach, like that community school model, offers a real path forward to integrate those critical services.
And it prompts, I think, an important question for you, our listener. In a nation like ours that spends so much on healthcare, yet leaves so many behind, what does it truly mean to be healthy? Is it just about whether you can see a doctor? Or is it about creating equitable conditions in every community, ensuring everyone has a fair shot to thrive with access to vital resources like broadband, good schools, comprehensive care, the whole package?
Yeah, consider this. The challenges facing our underserved communities, they are deeply rooted, they are complex, yet the solutions often seem to lie in recognizing our shared vulnerabilities, our shared struggles, and working together across those traditional divides. So what role can you play in fostering these connections and advocating for comprehensive, community-driven change, whether that's for better broadband or improved healthcare access, or just more robust community support where you live? The conversation, and maybe more importantly, the action, it starts with us.